Hi, everyone. Thank you for joining us today for our Policy Rounds webinar. I'll give it a few minutes to allow others to join, and we'll begin shortly. So hi, everyone. Thank you so much for joining us today for our Policy Round series webinar. Today, I am joined by Dr. Kirby, a professor at Dalhousie University, and he'll be speaking on wheelchair skills assessment and training. So a short introduction of the policy rounds. So they were created to share knowledge and insights on aging and technology research that is currently taking place. In this series, we discuss the policy implications of ongoing research. We also aim to connect with policy stakeholders, partners, older adults, and caregivers. The presentation is 30 minutes in total. Dr. Kirby will give a presentation of 20 minutes, followed by a Q&A of 10 minutes. So throughout the presentation, feel free to enter your questions in the Q&A, and he will answer to them once he's completed the presentation. So I'm just going to stop sharing, and then Dr. Lee can take it away. Go ahead.
Well, thank you for the opportunity of sharing some of the work we've been doing over the last number of years, and hopefully you'll find it of some interest to your group. Just to set the stage, I'm here representing a fairly large wheelchair research team that's been active for over 3 decades, and we've had funding from a variety of bodies, local, national, and international, which I'm not going to take the time to go over in the interest of time. No conflict of interest to declare, and the target audience is obviously you. As far as resources go, there's a website I'll be referring to, and we'll be providing a handout in a PDF format, and the session will be recorded, as Norma has told me earlier, excuse me. If you have questions, feel free to bring them up as we move along, or save them till the end. Or if you don't think of them until later, please feel free to contact me at the email address shown on the bottom. So my objectives for the session are that at the end, you'll be able to describe the World Health Organization process for wheelchair service delivery, the components of the wheelchair skills program, there are 2, the extent of research evidence in support of these protocols, and the relevance to clinical rehabilitation practice and policy. So starting off with the WHO process, wheelchairs, for those who aren't involved in the rehabilitation field, may not realize they are probably the single most important intervention that we provide to people with serious mobility impairments. They really do a tremendous job. The benefits are listed on the left, but there are problems that go along with those that are listed on the right. If one wants to tip the balance in favor of the benefits and to reduce the problems, there are 3 broad areas of intervention as one could use. Better accessibility, better wheelchair design, and better wheelchair service provision. We've been involved in all three, but mostly at the bottom level of the better service provision. So the World Health Organization in 2008 issued its guidelines on the provision of manual wheelchairs in less resource settings, but it soon became apparent that these were being used throughout the world in highly resource settings as well. And they've been revised just as of last year, released here. They're freely available online. And in those provision guidelines, there are 4 steps that are shown here. Selecting an appropriate wheelchair, whether it's a rigid frame or a type that the footrests come off if one has to stand up to get out of the wheelchair. Fitting the person to the chair to make sure it's of the right size. Training and use, and follow-up. It's the training where it has been the big emphasis of our group. So the second objective is the components of the Wheelchair Skills Program, and it began in 1996. We have a website shown here, and I'm going to familiarize you with that as sort of the outline for this section of the presentation. Well, we didn't invent wheelchair skills assessment or training, but we do have a system that's a little different than some of the other available ones. For the bullets shown here, we really do our best to focus on evidence-based approaches. We focus on both assessment and training because the two are interrelated. We're concerned about the wheelchair users themselves, but also their caregivers who are often necessary to accomplish tasks. We don't just focus on manual wheelchairs, but also power wheelchairs and scooters. The process and sequencing of the training in particular has evolved over a number of years, and it's rather important to a successful outcome. And we update our protocols often, most recently in August of 2023, and we're anticipating the next revision in August of this year. And finally, it's free. It's all open source, and there are no barriers to get at the materials and use them as you see fit. It's a Creative Commons license. So if we click on the menu on the skills manual and forms, we come up with a pretty thorough manual on how to do the assessment and training. It's 332 pages, the latest version. So it's a little encyclopedic, I'm afraid, but it does serve as a pretty good resource. And for particular groups such as caregivers, we've boiled it down into smaller handbooks. And we're expecting a pediatric one coming reasonably soon. In addition to the manual, there are forms for manual chairs and power chairs, and the power chairs include scooters. So as an example of the wheelchair skills test, the manual one, you'll see here on the left, there are 30 skills ranging from the very simple to the much more difficult. And each of those is scored in a 0 to 3 score, ordinal scale I'll show you in a moment, as well as comments being provided. The scale ranges from 0 if the subject is not able to do it at all. They can get a partial pass if they can get most of the evaluation criteria accomplished, or if they can direct the actions of another person, then the tester can serve as that other person. That's just been added in the most recent couple of iterations. A pass is if you accomplish all of the evaluation criteria, but there's room for improvement. And the advanced score of 3 is really if you do it in a highly proficient or advanced manner, that's really no room for improvement there. Now, the comments can be related to diagnosis. So, for instance, in this gentleman who was admitted to the rehab center here in Halifax with a left above knee amputation, we prescribed an artificial limb for him, started him in on his rehabilitation, but we eventually got around to looking at how he's propelling his wheelchair. And I'll just stop to see if we can get this video to move, and hopefully you'll be able to see that too. And as becomes apparent within the first 5 seconds, this gentleman was using very small thrusts with his hands, much like people with Parkinsonism, how they walk. And so it became readily apparent he had Parkinsonism, which was not previously known. We canceled his artificial limb, got him a power wheelchair, got him onto the correct medications, and that was very helpful. Just this brief equivalent of a gait analysis, but it's watching him propel his chair. The problems that we identified by looking at people perform their skills may be on the wheelchair may be the problem, as shown here. This gentleman has anti-tips that are too low, and you'll see how they hang him up at the bottom of the ramp. At this point, he's got float. His rear wheels aren't contacting anything. He's able to use his left foot to get off and past that, and then he can't get up the anti-tippers are so low he can't get up this small obstacle either. So it's not just diagnosis, but it's also problems with the wheelchair. We have quite a number of such videos on our, we have a wheelchair skills program YouTube channel that you can click on the bottom of the opening page of the website, and it'll take you to a page like this. There's, I think, currently about 700 videos on here, all broken down by manual, wheelchair, and so forth. A complete wheelchair skills test is shown in this upper left one here. If you're interested in seeing all of those skills being performed at a later time, we don't have time for that today. In addition to the objective wheelchair skills test, we have a questionnaire version. The objective one looked at capacity, what someone can do in a standardized environment. In the questionnaire version, it's what people do in their everyday life. So according to the World Health Organization International Classification of Function, that would be performance. Again, the same 0 to 3 scale. But in addition to can they do it, we can also ask questions about how confident are they in their abilities and how frequently do they do it with respect to how often they need to be able to do them or want to be able to do them. And just like there are ordinal scales on the back of that form as well. So you can, in addition to the scores and comments for individual skills, you can calculate totals, such as the total capacity score for the wheelchair skills test, or the total performance, confidence, or frequency score for the WSTQ. In addition to the comments for diagnosis and for wheelchair problems, you may see some insights that help with training, such as in this young lady who has been using a wheelchair part-time for several years, and you'll see her trying to get over some gravel. So I'll stop that for a moment here and just comment on it, that she makes the common mistake of leaning forward to try and put more force on her hand rims. Unfortunately, that puts more weight on the front wheels, and being small wheels, they tend to sink into soft surfaces. So the training tip that would come out of this would be for her to lean back a little farther to keep her front wheels relatively unweighted. And so it was really seeing how people perform their skills that led us to develop the wheelchair skills training program that arose from it. And it consists of the best available evidence on how to teach, process, and the best available evidence on content, what to teach. And the two together are the wheelchair skills training program. Just to give you an example of the process, I'm going to show you a short video here. And this demonstrates 2 or 3 of these motor learning principles. They're not complicated. There's about 50 a week that come out in PubMed in the English language, but they really boil down to very straightforward things. In this case, you're seeing her practice repeatedly trying to get her front wheels up onto the curb. And she's segmented the skill because she's not getting the rear wheels up. She's not approaching the curb. She's just popping the casters. The other motor principle here is using augmented feedback. In this case, she's using the mirror to see how high she gets her wheels. So that's an example of a few of the motor skills principles that we're referring to. As for content, there's a better and worse way for doing just about anything. And we've tried to accumulate those. Some of them have been published in the literature. Others are really on the basis of things we've learned from wheelchair users themselves. This short video was taken in Nepal, in Kathmandu, where we were there doing training of peers who do some training there. You'll see this gentleman coming down these few stairs in the wheelie position, and he exhibits really perfect technique. So that's an example of the process, an example of the content. The third of the objectives for this session are to discuss the extent of research evidence in support of these assessment and training protocols. And on our website, there's a section here called Impact and Publications. If you click on that, you come to a page that looks like this. We've had our healthcare librarian set up two dynamic links, the first one about assessment, and the second one about training. If you click on that link, you'll go instantaneously to a stylized search about wheelchair skills testing. And as of yesterday or the day before, I can't remember when I updated this, there were 120 published papers in peer-reviewed literature about the wheelchair skills test or its questionnaire version, or that had used them as outcome measures in other studies. Just as an example of the types of papers you can find when looking at that link, you can see one here looking at the measurement properties of the test for scooters among experienced users that we published just a few years ago. You can also click down at this other dynamic link that deals with the wheelchair skills training program. And as of a couple of days ago, there were 79 papers, including 16 randomized controlled trials. As an example of one of those papers, there's a training tip paper looking at travel direction on soft surfaces. And I'm not going to go into the details of that, but we were able to demonstrate and publish just in the past year how if you're a caregiver encountering a soft surface, that it's much easier to pull the wheelchair backwards over the surface than it is to push it forward. When you're pushing forward, you tend to push the casters, the front wheels, down into the soft surface. When you're pulling backwards, it tends to lift the casters up. So that's an example of the type of paper that will be found in there. So if we're looking at evidence for an intervention, and the wheelchair skills training program is an intervention, randomized controlled trials certainly are near the top of the evidence pyramid. But as you know, more recently, systematic reviews and meta-analyses where possible really have surpassed any single randomized controlled trial. And I mentioned there were 16 RCTs, but only a couple of systematic reviews so far. This one was published in 2018 on the basis of the first 13 RCTs that were available to us at that time. So I'll just show you the results of one of the forest plots here to illustrate that. And here are the 13 papers shown on the left, and the overall benefit is about 20%, a relative 20% compared to the baseline score and how much improvement there is at the end of that. In addition to the two systematic reviews that have been published and that you can find online, the World Health Organization carried out or commissioned a large systematic review done by an Australian group that they've included in their 2023 wheelchair guidelines. And of the 4 steps, the training has the strongest evidence support of those 4 steps. So that was nice to see that they were able to find the same thing that we were able to. In addition to looking at the effectiveness of an intervention, we're reasonably sure that if one does the proper training, that you can improve the wheelchair skills by about 20% above baseline. However, does that have any impact on people's lives? It's really this impact question that Kirkpatrick is focused on in his levels of evidence pyramid. And here we're looking at not low versus high impact and low versus high tech. And I think you can see from what I've shown you so far as examples that the wheelchair skills program is very low tech. You really don't need anything other than the environmental barriers that are readily available. And is there low impact or high impact? And we believe that the impact is high, which we'll go on to show a little bit of. Part of that is the low tech aspect is that we've been able to do this type of training in both high and low resource settings. I mentioned earlier in Nepal, but there's a number of other low resource settings that are shown here. The most recent is Ukraine. One of our team members is there for 6 weeks right now. This is their 2nd trip in the last year. Also, our website metrics give us a sense of how many people are using our website and what their distribution is. And as of last summer, there were over 180,000 unique users of the website from 200 countries. Our YouTube channel, we've been keeping track of for a shorter period of time, but quite a number of views, and we've got 1,700 subscribers to the channel to date. A little more formal on the impact side, this particular paper was done looking in less resource settings, particularly in Kenya and the Philippines. And what we did was we tracked down people who had received WHO-style services and people who had not, and wanted to compare their outcomes. And so this is a little detail. I'm not going to go into all the detail. You'll be relieved to hear, but we ended up with 13 different services broken down here, plus a composite score on the vertical axis. And then horizontally, 4 large, low granularity positive outcomes: daily wheelchair use, outdoor unassisted wheelchair use, high performance of activities of daily living, absence of serious falls, and then a composite over here. So if we just look over at the composite here, overall, the WHO service process works. These are odds ratios and confidence intervals shown here. But if you look at the individual services, some didn't have a positive effect at all, where others had more so. If you look at the one that had the greatest impact, it was whether or not people had received training. And so that's another example of that supports the training. We were pleased in that the most recent 2023 wheelchair provision guidelines of the WHO to have had a shout out from the WHO about our program within those guidelines. And that was a lot of positive feedback for us. So what I've been telling you about really is the wheelchair program's evolution. You might argue, and I would too, that we're fairly early still. We're only about 25 years into this process, but if it's already performing as well as it is, then we're optimistic that with further refinements as the years go on, we have a number of studies still underway that will gradually become fully upright and able to function in that upright position. That's not to say we should be waiting to implement the program. As Voltaire said, the perfect is the enemy of the good. So it's good. It's not perfect, but it's pretty good. So this is what the relevance to clinical rehabilitation practice is, really, that if you're not doing assessment and training of wheelchair skills, that you should be. And arguably, if you're not, and someone runs into problems, you might well find yourself legally liable. So we've done a couple of studies, one in Nova Scotia to start off, but this one is a follow-up study looking at, well, are therapists training their clients and their caregivers? Did a global online study for which we had 309 responses from 35 countries. And the majority of them said that 81% said yes, they did typically provide wheelchair skills training for clients, and a slightly smaller number for caregivers. However, the median duration of those training sessions was only 45 minutes and 30 minutes respectively in 1 to 2 sessions, which is really not an adequate dose of training at all. So that was a little on the disappointing side. Yes, people are starting to do it more often, but they're not doing a good enough job. So from the standpoint of your organization and the notion of policy changes, to help us get out of this death valley number 2 of clinical translational continuum, to get out of this death valley and into regular clinical practice, I think we do need policy. It's all very well to educate people about the importance of all this, but I really think we need to require it in hospitals and rehabilitation centers, that the job's not done until you've done your assessment. And if a person looks as though they could benefit from training, then you should be providing it. And you should be documenting whether or not they improved. So returning to our objectives, the WHO wheelchair service delivery process is 4 steps: select, fit, train, and follow up. The components of the wheelchair skills program are 2: wheelchair skills test and the wheelchair skills training program. The extent of research evidence, quite a bit and growing, and the relevance to clinical rehabilitation practice is relevant now and going to become even more so as the future goes on. So that's the end of my formal presentation. I'd be happy to take any questions.
Thank you so much for this interesting presentation. And I had written down partnerships, and I see that you have them all over the world, and that's interesting to see. Everyone, feel free to write your questions in the Q&A if you have any questions right now. So my question was, how, like for clinical practice, how do you think it could be implemented? Would that be like, is that a person, like someone who is there only for the wheelchairs, or how do you foresee it being implemented?
It varies a little bit around the world who takes the prime responsibility. It's always a teamwork thing in rehabilitation, of course, and different members of the team provide different contributions to it. But in Canada, it's primarily the occupational therapist who has the responsibility for the wheelchair provision. So other people on the team may identify someone as requiring a wheelchair, and then they would refer to the occupational therapist to actually get involved and do it. So really early on if somebody already has a wheelchair, then of course you can be asking them how well they're able to use it. You can use the wheelchair skills test questionnaire as a starting point for that. And then you can say, well, can you do it? How confident are you doing it? How often do you do it? Show me. And that they can show how they do it, and then you make your comments, and away you go. So that would be the typical way that we would do it here at the Nova Scotia Rehabilitation Center, for instance. It doesn't take very long. The questionnaire, even if you do the full questionnaire, only takes 5 to 10 minutes, and the wheelchair skills test a little longer, but that doesn't have to be done on everybody.
Oh, this is interesting. And I don't know if Jenna, do you have any questions? If you can hear me. Oh, I think she's not hearing me right now. Oh, well, thank you so much for your presentation. Anyone who needs to reach out, you saw the email that Dr. Kirby shared with us. Feel free to reach out to him. Thank you so much, and I'll reach out to you through the email for that PDF presentation, and we'll be able to include the recording which we have, as well as the PDF on our websites. Right. And so anyone who wishes to, you can refer anyone to it, and then I might be also able to share the links with you.
Thank you so much.
Thank you so much, Dr. Kirby.
Bye.
Bye.